Welcome to JAT Chat, presented by the Journal of Athletic Training, the official journal of the National Athletic Trainers Association. I'm Dr. Shelby Baez, an assistant professor in the Department of Exercise and Sports Science at UNC Chapel Hill and the co-host of JAT Chat. Today, I have the pleasure of being joined by Dr. Christa Nelson, who is an assistant professor of physical therapy and human movement sciences at Northwestern University School of Medicine. She is author of Are Prior Foot, Ankle, and Knee Injuries in Youth Sports Associated with Current Hip Pain in Young Adulthood, published in the Journal of Athletic Training. Christa, thank you so much for joining me today.
Yeah, thanks. I'm very happy to be here. Thanks.
So, starting with a very broad question for our listeners, what is the landscape of evidence regarding hip pain in young adults? What do we know and what don't we know?
Yeah, thanks for that question. So I think when we think about hip pain in youth athletes and in young adults, there is evidence that it is on the rise. I think most likely, participation in youth sports obviously is increasing, as is sports specialization. And so, at the time, right now, I think that 10% is usually the prevalence that I've seen for hip pain in adolescents and young adults, but that could be on the rise. So I think that's kind of what we know as far as hip pain as a symptom. Now, the literature with the connection between a prior injury and later development of joint pain, there is evidence. I'll use the knee as an example. If you have an ACL injury, an ACL reconstruction, especially at a young age, there is a lot of evidence now that increases the risk of developing post-traumatic osteoarthritis or knee pain down the road. There's also similar evidence with prior hip injury, increasing the risk for later development of hip pain and also at the ankle. What we didn't really know and what we didn't find a lot in the literature was whether injuries at other joints. In this example, I'll use the ankle and the knee with development of hip pain. We didn't really have that connection or that association, and so that's kind of where we started with our research question.
So, you started to allude a little bit about some other patient populations like ACL reconstruction. Can you tell us a little bit more about what prompted some of the exploration in patients with foot and ankle injuries and this development of chronic hip pain?
Yeah, so it's kind of two parts. I'll use some personal experience and also just in my clinical practice. So I had an ankle sprain, a pretty bad one, when I was playing recreational soccer when I was younger in college, and then developed hip pain later, maybe probably 10 years or so later. And so I always kind of wondered, and as a physical therapist, and thinking about movement and how one joint affects the other. And then, in addition to some of my clinical practice and seeing patients with that come in with, I'll use hip pain as the example. That's kind of my interest. And said, oh yeah, I've had previous meniscus injury on that same side or ankle sprains. And so that's kind of where the idea, I started, noticing a pattern, at least clinically. That's where the idea came from. And then looking into the literature, we had a student research group working with us that we were actually trying to find, like, okay, what do we know about this? And so we found that there wasn't a lot out there on that connection between joints. And if there were, a lot of times they combined prior like hip and knee injuries together, or they just reported a prior lower extremity injury in general and didn't actually look at what joint or what region that injury was. So I think that's kind of where this research idea and this question came about.
Well, thank you for sharing a little bit about your own story. It's always interesting to hear what prompts why people want to explore certain research questions.
Yeah, yeah.
So, along those lines of research questions, can you tell us about the purpose of your study and the methods you took to measure some of those outcomes of interest?
Yeah, so we kind of had one primary aim, and the outcome was looking at, or the aim, the purpose was looking at outcome of hip pain in adulthood and looking at reported prior injuries, specifically at the knee and also the ankle foot, and seeing if there was an association between those prior injuries and the current hip pain. So we also had some secondary interests of looking at not only just hip pain, but also, let's say, knee pain, and looking at how hip injuries in the past and ankle and foot injuries in the past may contribute to an association with that knee pain. So to do this, we did a electronic survey. We sent this out to university students, and about 420 or so completed the survey in full. To be included, they had to be between the ages of 18 and 24. They had to participate in youth sports before high school and during. And they couldn't have an injury in the prior 3 months to filling out the survey. And that was to avoid any effect of a recent injury on a reported joint pain. So the survey was fairly simple. We asked respondents their injury history at each joint region, and that was specifically an injury that took you out of sports or your sport for a week or more. And so that was to hopefully help people actually remember a more significant injury that had taken them out of their sport. And then we also asked so the injury history, I said at each joint, then also the current pain at each joint using using the visual analog scale, and then also current self-reported function. And so again, our primary analysis was looking at how the injury history at the other joints if it had an association with development of pain at the joint that wasn't injured.
So, what were the most important study findings for both that primary question as well as that secondary question?
Yeah, so I think the most important finding, our primary finding, was that the ankle and foot region really stood out among our primary analysis and as well as some of the secondary analyses. So, for example, in our primary finding, we did find that a history of, especially a knee injury and a foot ankle injury, so people that had both, a history of both regions, they were about 5 times more, had increased odds, about 5 times more likely to report more severe hip pain when they filled out that survey. But also just the ankle foot alone, even if they didn't have a history of a knee injury, that also increased the odds, I think, almost 3 times of reporting more severe current at the time of the survey, again, hip pain. So I think that was probably the main finding. The thing that surprised us the most was that the history of a knee injury by itself did not increase the odds of reporting more severe current hip pain. It had to be combined with the foot and ankle injury. And the results are actually similar. We looked at knee pain as an outcome and looked at hip and ankle injuries. It was really the combination or the foot and ankle alone that really had that stronger association.
Well, definitely find that interesting that you see this association with past foot,
Mhm.
ankle, and knee injuries and
Yeah.
predicting current hip pain. As a clinician, what are some things that athletic trainers, physical therapists, etc., should consider in their
Mhm.
practice, and maybe some changes they should start to consider based off the results of this study?
Yeah, so I think that there's maybe look at this a couple different ways, and individuals that let's say are in adulthood now or later in life, and they have the hip pain, just making sure, as many of us do, really to get a thorough history, and not only just knowing that history, but also trying to evaluate. For example, I'll use the hip pain with the ankle as the example, is looking at the entire kinematic chain in your movement analysis and also maybe looking at deficits or impairments at the ankle that could have been because of a prior ankle injury, for example, that might influence how someone's moving or an athlete's moving and potentially affecting the hip. So I think that's one thing to think of. The other side is that, although we can't say for sure with our design and prevention, I think athletic trainers in particular are at a really unique spot working with these youth athletes. And so making sure to really take into account tracking the injuries, continuing to track and manage, and then taking that to account when you're working with an athlete that is returning to sport, even if it wasn't for an ankle injury, but they had that history in the past.
And Krista, you alluded to something about like the study design here. And while
Mhm.
your study definitely filled a significant gap in the literature, research wise, what are the next steps to continue to fill some of these gaps that you've all identified?
Yeah, so yeah, this was a survey data, so there's always limitations. We're relying on recall of history or recall history of injuries, I should say. So there's limitations of just how someone remembers an injury. I think the one thing that could be improved in maybe a follow up survey is asking what type of injury or how severe the injury was. And also maybe how they sought treatment or if they did seek treatment. So I think that was one thing we don't have with our current study and could be done in a future study, as well as I think the side of the injury. We did not ask that, so it would be interesting to see the side of the current pain and also the side or sides. They've entered both sides of the previous injuries. So I think that's one step. And then, maybe in the future, looking at following more prospective studies of following athletes that have been injured. But of course, that takes just a little bit more time to actually collect and do that type of research.
Yeah, absolutely. And I didn't even think about the ipsilateral versus contralateral limb and looking at some of the differences there and seeing whether maybe folks who had these ipsilateral, whether the same injury and the hip pain was on the same side versus the other side. So I think that would be
Yeah.
fascinating to explore.
Yeah. Yeah. We're definitely interested in doing some more of that work.
I know for me, when listening to you and after reading the paper, one of the points that really sticks out in my head is that we don't just treat that impairment at the joint, but we have to think about treating the whole person,
Hmm.
including thinking about limitations above and below the joint.
Hmm.
What would you give as a take-home point about your paper for our listeners?
Yeah, if I think of like a take home point is that lower extremity injuries don't happen in isolation. So again, I always go back to the hip and ankle. But that ankle sprain at 15, even if we did rehab or it was managed appropriately at the time, still might influence the hip health later in life. And so that ankle sprain again, making sure that those impairments are really optimized and that the joint function is improved as much as we can to make sure that we're thinking of an athlete's long-term joint health, and again, if they don't happen in isolation.
Yeah, I think it's so important to think about not just the right now and the present moment when we're thinking about our youth athletes, but also making sure we're doing the right steps to preserve their overall long-term quality of life.
Yeah, absolutely.
Well, Krista, thank you so much for joining me today. It's really been a pleasure to be able to talk to you about this, very important paper that's published in this Journal of Athletic Training.
Yeah, thank you. This has been great. I really appreciate the conversation.
Yeah. So, to our listeners, I highly recommend everyone go and download this manuscript in the Journal of Athletic Training. Krista, thank you so much again, and we will see you all next time.
Yeah, thank you.